Karen Tang, It's Not Hysteria, Everything You Need to Know About Your Reproductive Health. In It's Not Hysteria, Everything You Need to Know About Your Reproductive Health, Karen Tang sheds light on the persistent and often overlooked issues in women's healthcare. This insightful book delves into the troubling history of medical mistreatment and the biases that still permeate contemporary gynecological practice. Readers can expect to gain a comprehensive understanding of both historical and current challenges, such as the dismissal of women's reproductive symptoms and the racial prejudices still evident in medical treatment. With a mix of enlightening history and practical advice, Tang outlines the anatomy of the reproductive system, guides readers on effectively communicating with healthcare providers, and explores common gynecological conditions. The book also emphasizes the significance of understanding hormonal shifts and reproductive options, empowering individuals to take charge of their reproductive health with informed confidence.
Reclaiming women's health. Imagine walking into a doctor's office with troubling symptoms, only to be told it's all just in your head. This experience is familiar to many and reflects a long history of misconceptions and mistreatment in women's healthcare. For centuries, a label of hysteria, rooted in an antiquated notion of the wandering womb, explained away symptoms with flimsy diagnoses, often leading to extreme treatments like marriage mandates or even clitoridectomies. Racism further complicates this troubling narrative. In the 1800s, figures like James Marion Sims performed surgeries on enslaved black women without anesthesia, driven by the racist myth that they experienced less pain. Today, such prejudices persist, leaving black patients undertreated for pain and experiencing poorer maternal outcomes than their white counterparts, despite similar socioeconomic conditions. The medical field continues to wrestle with these biases. Until the 1990s, women were glaringly absent from significant clinical trials, leaving a gap in understanding female physiology and drug interactions. This oversight results in millions of women facing inadequate treatment options for conditions like endometriosis. Doctors may resort to generic solutions such as birth control or hysterectomies, often dismissing symptoms as merely psychological. Resolving these deeply entrenched issues demands more than just incremental change. It calls for a fundamental transformation, increased research funding, equitable access to healthcare for minorities, enhanced training for providers, and improved insurance coverage. Empowerment through education is crucial, enabling individuals to champion their own health rights. The era of hysteria should be consigned to history, making way for informed, compassionate care that all individuals deserve. Understanding your anatomy. How well do you understand the intricate workings of your own body? Many find themselves unsure about the details of their reproductive anatomy, yet grasping this knowledge is vital for recognizing symptoms and advocating for your healthcare. Let's delve into this amazing system, starting with what you can see, the vulva. This includes the labia, clitoris, and pubic mound. It's worth noting that the clitoris is much more than it appears. Like an iceberg, its surface is just a glimpse of a complex network of nerves and erectile tissue beneath. The vagina, a muscular canal, connects these external structures to the internal aspects of your system. It houses a sophisticated bacterial environment, where douching disrupts the natural balance. This canal leads to the cervix, the entrance to the uterus, the nurturing site for growing pregnancies. Composed of a muscular wall known as the myometrium and an inner, shedding layer called the endometrium, the uterus prepares each month to either support a pregnancy or start anew. Connected to the uterus are the ovaries, small glands that release eggs and crucial hormones, estrogen and progesterone. Interestingly, you're born with all the eggs you'll ever have. These eggs travel through the fallopian tubes, where fertilization occurs, often a surprise fact for many who assume this happens in the uterus. The menstrual cycle orchestrates a monthly progression through hormonal signals among the brain, ovaries, and uterus. Each cycle sees an egg maturing and ovulating, with the endometrium readying for potential pregnancy. If fertilization doesn't occur, progesterone levels drop, the endometrial lining sheds as menstruation, and the cycle repeats. With this foundational understanding of your body's impressive anatomy, you're well equipped to engage in discussions about your health and confidently voice any concerns with your doctor. Finding your health voice. Navigating gynecological issues often begins with the challenge of articulating your symptoms to your doctor. You might sense that something is amiss, yet struggle to define whether it's truly abnormal, especially if it's been a long-standing experience. Many endure painful periods, heavy bleeding, or bowel problems because society or even healthcare providers have normalized them as part of womanhood. While these symptoms are common, you don't have to accept them if they're affecting your quality of life. The real question is whether your symptoms cause significant distress, impacting your career, education, relationships, physical activities, or general well-being. If so, it's time to seek medical help. Prepare for your appointment by meticulously documenting your symptoms and menstrual cycle details. Track aspects like cycle length, regularity, flow heaviness, the presence of clots, any weakness or lightheadedness, and any pain, as well as digestive issues such as diarrhea, constipation, bloating, and nausea. Mood swings, especially around your period, can also offer critical insights to your healthcare provider. By organizing this information, you'll be able to effectively communicate your key concerns in the limited appointment time, typically 15 to 20 minutes. Make sure your appointment is designated as a problem visit, not just a routine checkup, to ensure adequate time is allocated. When presenting multiple concerns, prioritize one or two key issues to address first. Your personal experiences offer essential clues for your treatment journey, even when tests are required to confirm diagnoses. Never downplay or allow others to dismiss symptoms that trouble your daily life. Arrive prepared with your notes, questions, and a clear idea of your health goals. Trust in your understanding of your body, and assert your right to be heard, validated, and treated appropriately. Understanding gynecological challenges. Gynecological conditions are a near-universal experience for individuals with a uterus, yet many remain shrouded in mystery. Let's unravel the complexities of 4 common conditions: uterine fibroids, endometriosis, polycystic ovary syndrome, PCOS, and ovarian cysts. Each of these issues presents distinct characteristics but often manifests through pain, excessive bleeding, and fertility challenges, significantly affecting daily life. Fibroids are non-cancerous growths in the uterine muscle that can lead to heavy, extended periods, pelvic pain, and even fertility issues or miscarriage. They are widespread, affecting up to 80% of black women and 70% of white women by age 50. Factors influencing their risk include genetics, race, weight, and early menstruation onset. Diagnosis typically involves a pelvic ultrasound or MRI, with treatment strategies ranging from medication to control symptoms to surgical removal of the fibroids or uterus if necessary. Meanwhile, endometriosis features tissues similar to the uterine lining multiplying outside its usual locale, causing severe discomfort during menstruation or intercourse, and sometimes affecting fertility and digestion. This condition impacts about 10% of women and is uncoverable through laparoscopic surgery. Management might include hormonal therapies, surgical removal of aberrant tissue, pelvic floor therapy, and lifestyle alterations. PCOS, a prevalent hormonal disorder striking up to 10% of women, is characterized by uneven menstrual cycles, heightened testosterone resulting in acne and excessive hair growth, and polycystic ovaries visible on ultrasound. Insulin resistance frequently accompanies PCOS, increasing susceptibility to diabetes and cardiovascular diseases. Although there's no cure, symptoms can be tempered with lifestyle changes, hormonal birth control, and diabetes medications like metformin. Ovarian cysts, fluid-filled formations, are usually benign and self-resolving. However, complications may arise if they burst or prompt ovarian torsion, causing sharp pain. Ultrasounds or MRIs diagnose these cysts, with surgery as an option for those causing significant problems. The immense prevalence of these conditions indicates that encounters with one or more are likely. However, with an understanding of symptoms and timely, individualized care, individuals can significantly enhance their life quality. Each reproductive phase, from menstruation through menopause, is underscored by complex hormonal changes affecting physical, emotional, and mental health, demanding awareness and proactive management. Hormonal journeys. Hormonal fluctuations are a regular part of the monthly cycle, impacting up to 75% of women with symptoms known as premenstrual syndrome, PMS, such as bloating, mood swings, and breast tenderness. While mild symptoms can be manageable, more severe cases might develop into premenstrual dysphoric disorder, PMDD, requiring a blend of lifestyle adjustments, therapy, and medical treatments. Pregnancy introduces another significant hormonal shift with the rise of progesterone to support fetal development. Despite the joy it often brings, pregnancy can also cause nausea, fatigue, and emotional challenges like anxiety. Proper prenatal care, nutrition, and stress management become crucial to handling these changes and preventing complications such as gestational diabetes and preeclampsia. Unfortunately, pregnancy loss is a prevalent experience, affecting up to 1 in 4 known pregnancies, leaving individuals to navigate the challenging mix of hormonal changes and grief. Infertility also affects millions globally, with options like IVF offering hope despite their emotional and financial toll. As women reach their 40s and 50s, menopause presents its own hurdles: hot flashes, night sweats, and increased health risks such as osteoporosis and heart disease. Hormone therapy is often the most effective way to manage these symptoms, though non-hormonal options and lifestyle changes are also beneficial. Navigating these reproductive health challenges demands a holistic, individualized approach. By fostering open discussions and reducing stigma, women can be empowered with the knowledge and support they need to manage these transitions more smoothly, acknowledging the complex interplay of hormones, health, and personal experience. Empowering reproductive choices. Empowerment in reproductive health means having a spectrum of choices and the autonomy to make decisions that best suit one's individual needs. Contraceptives play a key role, with a variety of options available ranging from hormonal choices like pills, patches, rings, injections, implants, and hormonal IUDs, to non-hormonal methods such as copper IUDs, condoms, diaphragms, and fertility awareness. Each has unique considerations like effectiveness, convenience, cost, and potential side effects, making it crucial to select based on personal priorities. For those seeking pregnancy prevention after unprotected sex, emergency contraception with copper IUDs or Plan B pills is a viable option. Some might prefer more permanent solutions like tubal sterilization, which involves the complete removal of fallopian tubes, thereby reducing ovarian cancer risk, or hysterectomies for certain medical conditions. These significant decisions should be approached with careful consideration and professional guidance. Abortion remains a deeply sensitive and politicized issue, with a significant portion of women experiencing one in their lifetime due to a range of reasons. Restricting access does not eliminate abortions but rather increases health risks. First trimester abortions can be safely conducted through medication or surgical methods, while later abortions, though less common, might be necessary for complex medical scenarios. Ultimately, the essence of reproductive health choices lies in the right to bodily autonomy and self-determination. Equipped with accurate information, individuals can make choices that align with their values and navigate these deeply personal aspects of life with confidence.
Karen Tang's It's Not Hysteria is a clarion call for revolutionizing women's healthcare. The book's key takeaways highlight the urgent need for increased research funding, equitable healthcare for minority populations, and better public education to advocate for reproductive well-being. By providing a detailed examination of reproductive anatomy and common gynecological issues, Tang emphasizes the importance of self-awareness and assertive healthcare communication to break the cycle of neglect and misunderstanding. Furthermore, she underscores the necessity of personalized and informed choices in reproductive options. This empowering narrative not only demystifies complex medical information but also affirms each individual's right to comprehensive and respectful healthcare. Readers are urged to harness this knowledge to challenge outdated norms and demand the care they rightfully deserve.